Hello, and welcome to CRPS Contender, my complex regional pain syndrome education channel. Today's video is Autoimmune Autonomic Dysfunction Syndromes, and we'll be taking another step down our journal journey where we discuss the current literature around CRPS so that we can have a better understanding of what is going on inside of our bodies and the choices we can make to reclaim our autonomy and improve our quality of life. This particular paper is not specific to CRPS only, but also includes topics on fibromyalgia, chronic fatigue syndrome, silicone breast implant-related syndromes, and post-COVID syndrome. This paper was written by two people whose last names I am probably going to pronounce incorrectly, so my apologies, but Mahroum and Shoenfeld from Turkey and Israel. This was published July 28 in 2022 in Pathophysiology. Let's take excerpts from their abstract. The pathophysiological mechanisms involved in chronic disorders such as complex regional pain syndrome, fibromyalgia, chronic fatigue syndrome, silicone breast implant-related symptoms, and post-COVID syndrome have not been clearly defined. The course of the pain in some of the syndromes, the absence of evident tissue damage, and the predominance of alterations in the autonomic nervous system are shared similarities between them. The production of autoantibodies following a trigger in the syndromes was previously described. In fact, the autoantibodies produced were shown to be directed against the autonomic nervous system receptors, leading to amplification of the perception of pain alongside various clinical symptoms seen during the clinical course of these syndromes. Therefore, we view autoantibodies targeting the autonomic nervous system resulting in autonomic dysfunction as likely the most comprehensive explanation of the pathophysiology of the disorders mentioned. Based on this, we aimed to introduce a new concept uniting complex regional pain syndrome, fibromyalgia, chronic fatigue syndrome, silicone breast implant-related symptoms, and post-COVID syndrome, namely autoimmune autonomic dysfunction syndromes. Due to its etiological, pathophysiological, and clinical implications, the suggested term would be more precise in classifying the syndromes under one title. In the introduction to their paper, they talk about the definition of pain from the International Association of the Study of Pain, which is defined as an unpleasant sensation or emotional experience associated with tissue damage. But this has received various criticisms over the last decades. The definition of pain is in need of regular updating due to the advances in researching pain at both the physical and the psychological levels, as well as the addition of cognitive and social components of pain. The debate and research in the field of pain etiology is very complicated, especially when it comes to chronic pain without apparent tissue damage or inflammation. Goebbels proposed the mechanisms of pain as an autoantibody pain, secondary to the binding of autoantibodies found in chronic pain syndromes and modifying the release of neurotransmitters, resulting in various intensities of pain. It was the undefined mechanisms behind post-COVID syndrome that brought the author's attention to the similarities between post-COVID and the other syndromes mentioned. The suggestion that a combination of biological, psychological, and social factors are involved in post-COVID pathophysiology strengthened the author's assumption that there was a common mechanism between these different entities. The presence of functional autoantibodies against G-protein-coupled receptors related to the autonomic nervous system in patients with persistent post-COVID symptoms, particularly those with neurological complaints, also supports the author's hypothesis that autoimmunity is the broad pathophysiological base. The authors introduce in this review a new concept in regard to the pathophysiological mechanisms of the chronic pain syndromes that we are discussing, and they call this autoimmune autonomic dysfunction syndromes. Let's start with CRPS, since that is the primary focus of this channel. In addition to pain, CRPS also has motor, sensory, and autonomic abnormalities. Patients with CRPS show a significant increase in inflammatory cytokines such as interleukin-8 and tumor necrosis factor in the acute phase of the disease, while in the chronic stage, TNF-A and bradykinins, among others, are elevated, and there is a decrease in substance P and E and L selectin. Patients with CRPS show a pro-inflammatory state manifested by high inflammatory cytokines in the blood, blisters, and cerebrospinal fluid. There are several differences in the different stages of the disease, whether you're in the acute or the chronic stage. The role of the autonomic nervous system in the manifestations of CRPS has been widely documented, but is not yet fully established. In those with CRPS, skin temperature was found to be warmer in the acute stage and colder in the chronic stage, when sweating was increased in both stages, and all of this was clinically significant. Alterations in the autonomic nervous system, particularly in the sympathetic nervous system, were demonstrated in people with CRPS. And about 40% of patients with CRPS have autoantibodies directed against beta-2 and muscarinic 2 receptors of the autonomic nervous system. Mice were treated with immunoglobulin G from patients with long-standing CRPS, and those mice had skin that showed prolonged swelling and hyperalgesia, as well as cellular changes such as activation of the microglia and astrocytes in the dorsal horn of the spinal column and in the pain regions of the brain. Due to the correlation between trauma and the appearance of CRPS, authors not of this particular paper but of a paper they were referencing suggested a term called IRAM, indicating an injury-triggered, regionally restricted, autoantibody-mediated autoimmune disorder with minimally destructive course. Let's talk about the sister syndrome of fibromyalgia now. Generalized and chronic pain is the central component of fibromyalgia, in addition to fatigue as well as cognitive and sleep disorders. There is a correlation between infectious agents and the development of fibromyalgia, and this is well documented. Structural and functional MRIs of patients with fibro have demonstrated several abnormalities in gray matter volume, pain modulatory system, and the pain matrix. Abnormalities in pain processing and neurochemical imbalances in the central nervous system were found to result in central amplification of pain. These abnormalities, with an emphasis on pain hypersensitivity, were postulated to occur secondary to autoimmune mechanisms. Patients with fibromyalgia were found to have a variety of autoantibodies, including anti-nuclear antibodies as well as anti-thyroid antibodies. Mice treated with immunoglobulin G from fibromyalgia patients were showed to have an amplified response to mechanical and cold stimulation. These mice were also found to have hyperstimulated incoming pain signals to the dorsal root ganglia of the spinal cord, responsible to the hypersensitivity of pain stimuli seen in fibromyalgia. Next is chronic fatigue syndrome. Fatigue is a subjective feeling of tiredness leading to an inability to conduct regular activities. While fatigue is the predominant complaint of the syndrome, chronic and generalized pain is common and often underestimated. There is also cognitive impairments, sleep disorders, as well as orthostatic-related symptoms. Infections and infectious agents were correlated and addressed as the trigger for chronic fatigue syndrome. Since the beginning of the COVID-19 pandemic, fatigue has been linked to COVID-19 in diverse manners. Correlation and similarities between chronic fatigue syndrome, fibromyalgia, and post-COVID syndrome are numerous, and they may share a common mechanism. There is reported significant alterations in the sympathetic and parasympathetic nervous system functions, as well as general autonomic dysfunction being strongly associated with fatigue. The autonomic dysfunction described was found to be related to autoimmune mechanisms. The autoimmune etiology of chronic fatigue syndrome includes autoantibodies against neurotransmitters and their role in severe metabolic disturbances seen in patients with chronic fatigue. Silicone breast implant-related symptoms. The correlation between silicone breast implants and autoimmunity in terms of production of autoantibodies is not a new finding. The main symptoms in women with SBIs were fatigue, muscle pain, several joint pain, dry mouth and eyes, cognitive impairment, and impaired memory. There was a significantly increased incidence of autoantibodies in women with breast implants, and they were found to have autoantibodies against 15 of the 20 autoantigens studied. There was also a correlation between the duration of how long the women had had the implants and the appearance of the autoantibodies. One researcher who was studying this syndrome suggested the name autoimmune dysautonomia following the detection of low serum levels of autoantibodies against the G protein-coupled receptors and the alterations to the autonomic nervous system. A chronic stimulation of the immune system by the silicone implants resulting in autonomic dysautonomia and the subsequent symptoms was concluded by the author of that study. Post-COVID, also known as long COVID. Symptoms of post-COVID syndrome include respiratory, cardiovascular, digestive, and neurological complaints. Brain tissues have been found to be highly permeable to COVID. It has also been reported of the immune activation and neuroinflammation as a result of the COVID infection. The role of the immune system in the manifestation and complications of COVID-19 induced by hyperstimulation and having too much iron and cytokine storm cannot be overemphasized. As a result, there is a strong relation between COVID-19 and autoimmunity in the terms of pathophysiology, presentation, complications, and treatment. Long COVID patients showed significantly high levels of autoantibodies against, again, the G protein-coupled receptors directed against the autonomic nervous system, including beta-2 adrenoceptors and muscarinic receptors similar to CRPS, impacting heart rate and rhythm via electrical conduction. Nociception-like opioid receptors were also shown to be targeted by these autoantibodies. In conclusion, the authors view autoimmunity in the form of autoimmune autonomic dysfunction as a potential pathophysiological mechanism of complex regional pain syndrome, fibromyalgia, chronic fatigue syndrome, silicone breast implant-related symptoms, and post-COVID syndrome, as revolutionary. As the pathophysiology of the syndromes addressed is still unclear, the presence of autoantibodies directed against the autonomic nervous system receptors and the subsequent clinical presentations offer a comprehensive pathophysiological explanation. The term autoimmune autonomic dysfunction syndromes could serve as a base for directed research, initially through detailed animal model-based experiments, followed by appropriately designed clinical studies. The results will doubtlessly improve the diagnosis of the syndromes and provide targeted treatment options. And that concludes that particular paper. Short and sweet today. Thank you very much for watching. If you like what I'm doing here, please engage with some way so that the algorithm can put this information before more people who need to see it. If you would like to support the work, I have a PayPal or a Patreon. You can also check out my website. Thank you very much to W for Shep for your continued support. It really means a lot to me. If you'd like to check out this paper directly or have access to the slides, I'm going to link that in the description so you can check that there. Okay, I think that's everything. Thank you very much for sticking with me, and I hope you learned something today. See you next time.